Hi everyone, my name is Josie Liao, and this presentation is on addressing food insecurity and promoting health through nutrition. But before I get into that, here's a bit of a self-introduction. I'm currently a rising senior at Solon High School in Ohio, and I'm particularly interested in human health and aspire to explore careers in the fields of nutrition science and human biology in the future. I'm actively involved in many extracurriculars at school. I'm a national qualifier and OCTA finalist in speech and debate and informative and expository speaking. I'm a varsity volleyball player, and I'm the founder and president of the Women in STEM chapter at my school. I've also conducted research in nutritional science at a few internships, and after noticing the negative effects that unhealthy nutrition habits can have on my own health, I co-founded Act for Youth Health, which is a nonprofit organization promoting health and wellness in youth. Now, when I was younger, my favorite meals were my mom's cooking. But I wouldn't always be motivated to finish my food, so she would tell me stories, like that for every grain of rice I had left in my bowl after dinner, my future husband would gain one more pimple on his face. And even though the idea of a husband seemed so far away, I would then be forced to finish the bowl anyway. But I would have never guessed that I was lucky to be able to finish a meal, let alone have a nutritional dinner at all. So today, I'm here to address a critical issue that affects millions across the globe: food insecurity and its relation to malnutrition. Let's first define food security. At its core, food security refers to when all people have access to sufficient, safe, and nutritious foods that meet their dietary needs and food preferences. Food access and healthy eating are critical components of public health, particularly in underserved communities where there are barriers to obtaining this nutritious food. According to the U.S. Department of Agriculture, nearly 17 million households in the United States alone were food insecure during 2022. Poor dietary habits as a result of limited resources are linked to various health issues, including obesity, diabetes, and cardiovascular diseases, highlighting the need for effective interventions to promote healthy eating. This presentation aims to highlight the importance of addressing food insecurity, understanding its systemic causes, and exploring potential solutions. With the issue of malnutrition on the rise, we must do our best to address it. By understanding the background and implications of food insecurity, we can better understand malnutrition and promote equitable health outcomes. So I started noticing the global issue of food and its relation to nutrition from a young age. Specifically, my own journey of physical growth profoundly shaped my perspective on nutrition. My sister and I differed greatly in our childhood growth. She had always been in the 90th percentile of the growth curve, whereas I was only in the 20th percentile. We grew up with the same environment and conditions, but other factors like nutrition and genetics influenced us individually. Observing myself in relation to those around me, I then grew curious to explore nutrition more deeply and dove into the implications of demographics and socioeconomic conditions on nutrition and children in the U.S. Independent studying helped me find out that malnutrition has severe consequences, including stunted growth, impaired cognitive development, and increased vulnerability to infections. This issue affects individuals across all demographics and disproportionately impacts marginalized communities. As I continued my studies, I took an opportunity to explore nutrition along a bit of a different path. I realized that the gut microbiome plays a crucial role in nutrition and overall health. Under the guidance of professors at George Mason University and GI doctors at Metro Health Hospital, I was able to conduct research on this aspect. My research has shown that gut dysbiosis, or imbalance in gut bacteria, is linked to chronic diseases such as kidney disease, diabetes, and liver disease. Here are examples of networks that my research team and I made in our studio to analyze the most prominent bacteria in chronic kidney disease and comorbid diabetes. The results of our study showed us the significance of certain genera as well as the effects on them as a result of comorbidity. And in this case, comorbidity, which is just patients with both CKD and diabetes simultaneously, are also the patients that have less nutritious gut microbiome ecosystems because they have more clusters formed in their microbiome samples, as seen in the network. Then, following this research, we addressed the issue of malnutrition by looking for various techniques to remedy and repair gut microbiome deficiencies. These included probiotics, probiotic, prebiotic, and symbiotic intake, which are dietary supplements promoting the growth of beneficial bacteria, phage therapy, which uses bacteriophages to target and destroy harmful bacteria in the gut, fecal transplantation, which transfers fecal bacteria that is healthy to restore a healthy gut microbiome, bacterial consortium transplantation, which introduces a defined group of beneficial bacteria species to improve gut and overall health, and many more. But what else besides caring for ourselves and our own gut health can we do more generally to improve nutrition worldwide? Well, one thing is that effective nutrition interventions and public health policies are crucial in addressing malnutrition. Community education programs play a significant role in promoting healthy eating and food access. According to an article I read by Dr. Laura Bellows, Associate Professor in the Division of Nutritional Sciences at Cornell University, engaging in youth in participatory action research, which is an approach to research that emphasizes participation by members of communities that are affected by that research, could empower youth to become advocates for health within their communities. The Youth Can, or Change Activity Nutrition Project, demonstrated this by involving adolescents in research using socially engaged art to explore food access issues. Through activities like this, youth identified barriers to healthy eating and collaborated with adults to propose solutions. This approach fosters positive youth development and promotes equitable food access. To conclude, by understanding the systemic causes and impacts of food insecurity, empowering youth through participatory research, and exploring scientific insights into nutrition and gut health, we could make significant strides in combating malnutrition. We could just start at the local level, whether it's through food bank funding, recycling only slightly damaged grocery store items, or simply providing easily accessible food pantries at school. Let's reaffirm our commitment to ensure food security for all individuals and, circumstantially, reduce the number of pimples on our future spouses' faces. These are the references that I used in my presentation, and I'd like to thank my parents and my sister for their encouragement and support, and I'm also extremely grateful for all the guidance that I've received from mentors, especially Professor Menghao Lee from George Mason University, Dr. Gunqing Song from Metro Health Hospital, and dietitian Maria Schwartz. And thank you to the audience for listening and engaging in this important topic, and to the directors of the program for the opportunity to speak in the Student Speaker Series at the Global Health Leaders Conference at Johns Hopkins University. That concludes my presentation, but if you have any questions or just want to connect, feel free to reach out to me via email or LinkedIn. Thank you.